So one of the most exciting things this year were the change in the atrial fibrillation guidelines. It's going to impact hundreds of thousands of patients across the world. The number one breakthrough is that it's very clear now it's a class 1 level of evidence, a very strong guideline indication that if the patient has AFib, try to close the left atrial appendage. That's where blood clots form. That causes strokes. On Tuesday, a case I did, it took 86 seconds to put a clip and close the left atrial appendage, and that will decrease the risk for stroke by 33% over the next 3.5 years, probably even more at 5, 10, and 20 years. So it's quick, it's safe, it's simple to do, and it's super effective. So it's being adopted more often to do this. It's probably in about 50 to 60% of cases these days that the surgeons will do it. But remember, this is kind of new technology. This is new data. This wasn't out there before. The data was released during the pandemic, and so it wasn't disseminated like it would be today. And it took a little while for us to change the guidelines. Although it is improved compared to 10 years ago, now we're hoping that it's going to be a really steep, quick rise. To treat the atrial fibrillation, we frequently use something called the Cox-maze procedure. Jim Cox is the person that developed it, and it just so happened I hired him back. He's a friend of mine. He's really the creator of this field that has now treated millions of patients. The operation itself, especially initially, was very complex. There were a handful of us that were doing it around the world, but not that many. They started to develop some tools to do it so that it's equally effective, but much quicker. So Northwestern has always been, very involved in this, in the surgery for atrial fibrillation. I was the second person after Jim Cox to do one of the cut and sew mazes, and so it's been a long-standing interest. And it's great to have a group of people and researchers that have really helped us develop this field, and it's great to have Jim, my friend and my mentor, back.